It's incredibly important for us to meet families where they're at. And when your family is experiencing a mental health crisis, you need someone on the other line of the phone who first answers the phone, secondarily has a deep passion for serving patients with mental health disorders. At BasePoint, our patient access center is open 7 days a week from 7 a.m. to 7 p.m., 365 days a year. We've developed our assessment and admission process to help families when they don't know where to turn, when they have a child or a young adult that's struggling with mental health disorders.
So oftentimes people go to an ER to seek an immediate assessment. They'll do a brief assessment and direct that person to a psychiatric hospital. And what we saw with that process, many people were being admitted inappropriately. We effectively prevent hospitalization by providing assessments immediately. It's not typical for you to be able to access mental health care on the day that you need it from a skilled provider. We have the ability to do same-day assessments, walk-in assessments, virtual assessments, and give them the recommendation for the most appropriate level of care at that time. What we are able to do is to meet you same day and to help service you and get you connected with the best resources. Our assessments are around 2 hours with a licensed clinician where we are exploring what that patient's needs may be. After completing the assessment, we are then providing a recommendation for level of care and then getting them connected with the best fit for that person. We know if we're at this point where we need our care, we are going to start as soon as we can. And delaying doesn't help the situation or help that patient get better. If they're recommended to go ahead and start with us, they're going to be able to see our double board certified psychiatrist the next day. And then from there, we'll get them set up for that admission morning, arrival times, what they need to bring, what the parent can anticipate and what the patient can anticipate for that day. They're going to be able to start group therapy and family therapy, and that way they're getting intervention to help support on their road to healing. Oftentimes during an assessment, we hear concerns regarding finances, about what is going to happen with school for that child, how they're going to even make this happen with transportation for their student to get to the program. And we've found ways to support the family in all these needs. The admissions and discharge team is made up of dedicated social workers who are passionate about providing access to care. Treatment without a discharge plan is often ineffective. When you've completed your time here with us at BasePoint, our Beyond BasePoint team will remain engaged as long as you need it.
At the end of the day, it's all about the people that provide and deliver excellent mental health services. It's a culture of people that care and want to provide excellence, and we've recruited the best in behavioral health care.